Hi, my name is Yesenia Romero. I'm a nursing student with Harper College, and I'm going to be your nurse for today. How are you?
Good.
Good. What is your name?
Leo.
Leo? What's your last name, Leo?
Bañuelos.
Bañuelos. And how old are you?
82.
82. Okay, Leo, do you have any allergies to any medication?
No.
No? Okay. I'm actually here today, Leo, because I have your glaucoma medication that I'm going to give to you, okay? Okay, this medication, I'm going to explain a couple things about this medication to you, okay? Okay. So, with this medication, it's to treat your glaucoma. It comes in eye drops. So we're going to put it directly onto your eye because we want it to work locally, okay? We don't want it getting into your body and your whole system. We just want it to fix your glaucoma problem. So how it fixes it is, you know that little black pupil in the middle of your eye?
Mm-hmm.
It's going to make it smaller. And by making it smaller, you have a little opening in the corner of your eye. So it's going to it's going to pull it and make it bigger. Okay, so when we put the medication inside, it's going to constrict your little pupil. It's going to open the little hole and make it bigger. And this allows the fluid that's inside your eye to leave your eye. And what that'll do is it'll take off the pressure from your eye and it'll help you feel better. It'll help with the glaucoma, with your glaucoma. Okay, so a couple things with that though. We only want it to work in the eye. After I put the drops on you, I'm gonna ask you to hold right here in the little opening. I want you to close it when I put the drops in you, okay? That way it won't get into your body system, okay? Does that make sense? Okay, so you're gonna close it for 1 or 2 minutes. When I put the drops inside you, you're gonna close your eyes. You're gonna close the opening for 1 to 2 minutes, okay? Okay, if it gets into your body, there are some side effects that you will feel, and I need you to let me know right away, okay? I will tell you, these side effects could include increase in sweating, so you might sweat a lot. Other side effects could be nausea, vomiting, diarrhea. You could also have watery mouth or like even drooling, lots of saliva in your mouth. Other things that you might have difficulty breathing, wheezing, or you might even have bronchospasm. So any difficulty with breathing, let me know right away, okay? If you get these while you're at home, call the doctor right away or 911 right away, okay?
Okay.
When I initially put the drops inside you, so those are the systemic side effects. Now we're going to talk about the local side effects, okay? So this is what's going to happen. You might feel burning or irritation, okay? Not really, okay? Okay, so you might feel burning or irritation to your eye or itchiness. Some people report blurred vision, but usually these effects are only temporary, like maybe 3 minutes, just so your eye kind of gets used to it. Other things that you might have are like headache or brow ache. A lot of people report their brows ache for some reason. The headache, you got to be careful with that because it could be a systemic thing too. So if it's continuous, so if you have a headache, report it. If it's continuous, continue to report it, okay? Another systemic effect that I forgot to mention was slow heartbeat, slow heart rate. If you notice your heart rate is too slow, if you want to check, you could check your pulse right here and count it for a minute. Anything less than 60 is too slow, so tell your doctor right away. But back to the local side effects. With the local side effects, this is what will happen, okay? So your little pupil is going to constrict and it's going to get smaller, right? The pupil is what lets the light in. So what this means is your pupil will now be smaller. So your pupil will not be able to let a lot of light in. So it will be very hard for you to see in the dark. To prevent injuries, to prevent falls, I need for you to keep your house well lit. Soft light bulbs are an excellent choice, and they maintain the house, and just maintaining the house well lit, that will help prevent injuries. Also, I want you to not drive at night. We discourage driving at night because your eyes do not accommodate to the dark. They will not dilate. they will not let the light in. They will not get bigger. They will stay small. So light will not come in. Your eyes will not accommodate to the dark. So what that means is that if you drive at night, you will not be able to see and you'll likely crash. And that's why we're saying please do not drive it when it's dark outside. Because we don't want you to injure yourself, injure anybody. Okay, so those are pretty much the side effects. Now these drops, they do tend to have a lot of preservatives. They're only good for 4 weeks once you open it, okay? They have a lot of preservatives. So if you notice redness or swelling, that could mean you have developed an allergy to these drops, okay? They're single doses, and those are only good for immediately. When you open them, you gotta put them on right away. Those don't have preservatives. So if you're allergic to this, you might not be allergic to the ones without preservatives, okay? So, do you have any questions for me?
No.
No? Okay, perfect. So I'll review how we're gonna administer the medication, and then I'll administer the medication, okay? So I've asked you about allergies. I also would do my 7 rights, make sure it's the right dose, right time, right patient, right medication for the right reason, and right route. Okay, so now what we're gonna do, we're gonna pretend I haven't touched that bottle that I was playing with. Okay, so I'm gonna wash my hands. I'm gonna don on some gloves. I'm gonna look at your eyes. Now, I don't see any drainage. There's no tearfulness. If I did see drainage or tearfulness, I would grab a tissue and clean you up, but I don't see any of that. And then I would wash my hands again and put on gloves. So what I'm gonna do is I'm gonna give you this tissue to hold, okay? Okay. And then, yeah. And then here, let me run through you real quick what we're gonna do before I actually do it, okay? So what we're actually gonna do is, I wash my hands, I put on gloves. I'm gonna have you tilt your head back, look up, and then I will pull your bottom eyelid. I'll place the drop there. You're gonna close your eyes for 1 to 2 minutes. You're gonna remember to cover that opening with your finger, that opening between your eye and your nose, and then you're gonna close for 1 to 2 minutes, okay? And then if you had other medication like additional eye drops, you can only put 1 eye drop at a time, because your eye can only, it's very small and it could only handle one eye drop at a time. If you put 2, one of them is waste. So, and you need to keep that 1 eye drop there with your eyes closed for 1 to 2 minutes to allow it for absorption with your eyes closed. Okay, don't blink, just keep your eyes closed when I put the eye drop, okay?
So I just go like this?
Excuse me, yes, sorry, yes. That's correct. Okay, let me wash my hands again. Okay, so, and if you did have other eye drops to instill in that same eye, I cannot put them until I gave your eye at least 3 to 5 good minutes for it to absorb the first eye drop, okay? Does that make sense? Okay, at home when you do this, please always wash your hands, okay? Always, because it's very easily for the eye to get infected. So we don't want that to happen, okay? So always wash your hands, and then be very careful not to touch the bottle and not to touch your eye, okay? So we will start. I have washed my hands, have put on gloves. I will open the medication, being careful not to touch the tip. We'll grab a tissue. And the tissue is just to wipe away any excess tearing that might come out, okay? All right, so what I'm gonna...
Wait, do I close it right now or after?
No, I'll tell you when, okay? As soon as I put the drop, then you'll close it, okay? So right now you're gonna tilt your head back and then look up, and then I am gonna pull this lid down. I'm gonna apply this to the lid, close, and then apply pressure gently for 1 to 2 minutes. And then afterwards, I would just assess my patient to see how my patient is doing. And that would be the end.